Thrilled to have and be able to introduce our next panel discussion on supporting child mental well-being. We've started the day with our keynote as a good overview. We learned that we need to support parents before they're ready to support their children, to put on your own mask before you can put on anyone else's. So now happy to roll into child mental well-being and supporting that. And for this conversation, I am thrilled to introduce Dr. Faye Kokotos. Dr. Kokotos is one of the wonderful medical professionals that works in Greater New York and supports the Reach Out and Read program. She is an assistant professor of pediatrics at the Albert Einstein College of Medicine and is a clinician educator in the Division of Academic General Pediatrics at the Children's Hospital at Montefiore. She is also the Associate Medical Director of the Pediatric Practices at the Family Care Center and the Medical Director of the Reach Out and Read program. And I will also share in advance, she's also been nominated and will be awarded tonight one of our Reach Out and Read of Greater New York awards. So we're thrilled to welcome Dr. Kokotos as our moderator.
Okay. Good morning, everyone, and thank you for that lovely introduction. I'm really very excited to be here today to introduce our distinguished panel. The topic will be on child mental well-being. Thank you, everyone. And here we go. Dr. Tanya Maria Caballero is a pediatrician and the assistant professor of pediatrics at Johns Hopkins School of Medicine. Her research interests include innovative ways of identifying and supporting the maternal health needs of immigrant Latinas within the pediatrics office to promote resilience and optimal health among immigrant children and families. Our next panelist is Dr. Jacqueline Duggay. She's a pediatrician, author, speaker, and the founder of What is Black? It's a podcast. She's a child health expert on the issues of the impact of racism on children's health and helping parents to talk to children about race and racism. And she's also, I just have to point out, a co-author of the American Academy of Pediatrics policy statement on the impact of racism on child and adolescent health, which was published in 2019. And I recommend every pediatrician and pediatric trainee to read this policy statement. And our next panelist is Scott Iseri, who is the Director of Creative Innovation at the Committee for Children. He is the award-winning producer, narrative designer, and creator of the Imagine Neighborhood podcast for children and families. And welcome all. So are you ready to start? Okay. So thank you again for sharing your experience and your expertise as part of this panel. The first question will be on what does child mental well-being mean to you? Give us a working definition to orient us in this space. And I'll start with Scotty.
Morning, thank you. And thank you for starting with me, the least credentialed person on the panel. So it's so thrilled to be here with y'all. I know there, in terms of child mental well-being, there's a lot more clinical and probably precise definitions out there. But a lot of my work on the Imagine Neighborhood is taking a lot of really big concepts like growth mindset or resiliency and translating them into essentially, fart jokes and robot dinosaur stories. And so we really focus on how do we take some really big concepts and turn them into things that kids can absorb, understand, and put into practice. So one of the things that we talk about a lot, and this is, again, a very oversimplified definition, but we talk about kids being healthy, happy, and kind. Those are three things that are not mutually exclusive. You can be very healthy, but maybe not happy today. You can be super happy even if you've got a cold. But those are sort of our check-in points. They're actually ones that I do with my son. I like thinking about being healthy, happy, and kind. But it's a way that we can get it. The three important things for us. How does your body feel? How does your mind or your heart feel? And how do the people that you care about feel?
I love that. Being happy, healthy, and kind. Okay. Next, I would like to ask Dr. Dougé if she has anything to add to Scotty's definition.
I actually love that definition. I think for me, again, coming from having the credentials and clinical background, I think it's true. And I love the fact that Scotty really helps break down these concepts for kids and even families, right? Because I think even as a clinician, sometimes I struggle with, understanding well-being, the definitions, right? But putting into practice and how you're feeling. And I think for me, what it ultimately means, especially for children, to have child mental well-being, is having the space to talk about feelings.
Okay. And Dr. Caballero, do you have anything to add or highlight about this concept?
Yeah, I think about it, adding to that it's the sort of the ability to experience joy and wonder in everyday things, but also, and the skills to address challenges, disappointment, and unpredictability along the way in a safe and healthy environment, because acknowledging that kids are going to experience that emotional dysregulation, disappointment, fear, but that well-being is really the skills and the space to navigate that in a healthy way.
Yeah, I totally agree. This sort of builds on our earlier panel discussion. And, it's really focusing on the children's emotional health and learning how to navigate what I call the good, the bad, and the ugly of life, and giving them the tools and the skills to give them the resilience and the strength to handle those situations as well. Thank you. Our next question will be, we've been focusing so much on the COVID pandemic. This is something we've lived through the last few years, and still moving forward, still dealing with it. But what have we learned from the COVID pandemic? How has it impacted child well-being in recent years, and what sort of supports are available? And I'll start with Dr. Caballero.
I think we all have our own, I think one of the unique things about this situation is, first, it has affected all of us in some way. It isn't like a natural disaster has occurred in one area and people have come from other places who are, they're strong, they're well rested, they're in a stable place, and we can come and help others. We've all been affected in different ways. So I think that we all could probably reflect on some experiences, but I'll name sort of three things. I think first and foremost for young kids, it's isolation. As just, one example is, depending on the developmental stage of the child, isolation, can be really, really impactful for kids who are just learning how to be social, how to interact, because then the extreme isolating situation occurs, and then they're going out back into the open, and then that overstimulation is hard to manage for a lot of kids. I think it has also both exacerbated and masked certain mental health conditions. So you have for example, would be an exacerbation is someone who perhaps has some, obsessive compulsive tendencies or things like that, and then like frequent hand washing, fear of germs, and then all the messaging is don't touch that, don't wash your hands 20 times a day, so I think that some of the things that people are trying to control, even young kids who may be sort of having those tendencies that may have brought out some things that they are not in such an extreme way that it sort of brings out something concerning like that. And then I think masking. And so this may be true for some older kids, but kids who have social sort of anxiety symptoms and social situations, the staying at home all the time and doing everything through a screen in a way has helped them kind of work around those things that are really difficult, and not maybe and make it difficult for us as clinicians to isolate, to identify those as things that they need support and help with, because they're doing great. Okay, they're doing fine, check. Okay, where's the next fire we need to put out? And so I think that it really, those are just sort of three things that come to mind for me.
Okay, Scotty, any additional thoughts?
Yeah, I had a couple. I mean, one thing that really became evident for us as we were working on our show, one thing we do that's sort of baked into every episode is that we prompt kids to talk to their grown-ups. So we'll have questions like, ask your grown-up how their body feels when they're angry, or ask your grown-up how they deal with their own bad feelings. And what we heard from a lot of our listenership was like, that was such a good check-in for the grownups as well. Like throughout the last 2 years, there's been a lot of conversation around how is this affecting kids? How is this affecting kids? And really, we as the grownups in the room were also being very strongly affected by it. And it gave us this opportunity to open up those conversations, to like require or request that kids and adults have these conversations about how they're doing, about their mental health, about their well-being. And so, I mean, I caught the very tail end of the last panel, but there's that notion of like putting on your own mask first, and like having grownups that can focus on their own social and emotional skills helps the kids do it. They can see it in the grownups that they're around. I also think there was something that was really interesting, you know, about the way that, I'm sure we've all seen videos of someone, you know, throwing a fit in a grocery store because they had to wear a mask, or people getting, you know, booed off a flight because they won't wear a mask, things like that. But and those are real concerns. Those are really difficult things. I don't want to minimize that, but I know for me, it offered me the opportunity to talk to my kid about masking, for example, as a kindness, that this is a thing we do for our community. This is a thing that we do for the world around us. And it opened up a really great opportunity to talk about how we were all coming together in this time. It may not have felt like that. I mean, it felt like we were very isolated, and it may have felt that that there were potentially bad actors out there who were not being kind to their communities, but there were a lot of them. You could walk around and see that people were wearing masks. You could see that, you know, that the early days of the pandemic, when people were applauding for first responders, and so that was I don't know that there's other opportunities to see that kind of community action, to see those kinds of moments of coming together. That I thought was a real opportunity for a lot of the adults in our listenership.
Dr. Dougé?
Oh, so I agree with Tanya and Scotty, but I think what's also amazing is that, like, in practice, I mean, I think there were concerns, you know, at the beginning of the pandemic, right, as we started to talk about kids wearing masks and how would they respond to it. And what I find it so interesting now, right, is that for many kids, right, kids born either during the pandemic or maybe preschool age at the time that the pandemic started, this is normal for them now, right? This idea of wearing masks. Not that it should be normal, right? But it just is. And what I applaud is that a lot of parents working on their own issues about masking, but also wanting to keep their kids safe, you know, really enforcing the mask when possible. You know, you had these little ones coming into the office, and of course they had their mask sometimes below their nose, right? And mom and dad would be like, okay, you know, trying to pull it up. Or you see the babies, when mom is holding, or the dad is, you know, whoever the parent is holding the child pulling down the mask, wanting to see mom and dad. What I was reassured by, right, and for many of these family cohorts, right, is that they found a way, right, to make things work, to make their children feel supported. And if necessary, many parents asked for the support they needed, or we offered the support, right? Because we're screening for that, right? We're screening either for potentially, many practices are screening for postpartum depression, both in moms and dads. And we're also screening for doing the behavioral screening. I'm not saying everything was, you know, roses and peaches and roses, right? But what I found is that for many families, right, we really talk about those who have been directly impacted, right, negatively impacted. But there were also many families who found a way through community supports, through community initiatives, that to support the family, found a way through this and really became models for me as a provider to share with other families. But I'm also very, you know, very hopeful is that, you know, if we provide the supports for children when they need it, right, and not just because it's a pandemic, but even after the pandemic, right, as we're going into whatever this new iteration of life is, right, that we make sure that we continue these supports. And because of, you know, these national emergencies of child mental health, right, we now know that it's really come to the forefront that we need to do something. And I find it comforting and reassuring to know that this is on all our minds. How do we support families and children? and especially very young, right? We knew about ACEs, we knew about adverse childhood experiences, but somehow I think that got lost in the, we talk about trauma-informed care. I think that somehow got lost, but sometimes I think it takes something of this magnitude to really shake things up and make us realign our purpose and realign our mission to support children and families. And that's reassuring for me.
Thank you. I agree. This crisis has shown us that the mental health issues have always been there, but it just pushed it over for many families, and it opened it up to making more of us aware, and on a national level, that this is really something we need to work on and to help our families to provide the supports. Scotty wanted also to make some additional comments, so I'm going to let him contribute.
Yeah, so part of the question was about, like, what did we learn about the types of supports and resources? And my example is very much from the education field, but I feel that I know this has reached out into other other fields as well. So when remote learning started, me and my parent group had a very similar experience, which was getting an email that said, download this app, then create a login. When you create that login, create a login for your kid. Then when you go there, you want to go to a reading assignment. So click reading. When you click reading, it'll go to this website. You have to create a login there. Now create an account. Now create a profile for your kid. Now do that with the math. It was, on one level, it was a real massive failure of technology because it was very, very convoluted. It was a lot of work to get up and running just so a kid could do online lessons. So the biggest takeaway for us and what we've really focused on is, like, easy to use. How do you get someone that it's 2 clicks away, that if they need a mental health support, that it's right there. It's in the email, they click the thing, they go straight to it. Even something as simple as, like, downloadable things to print out. Those can be fantastic, but if you don't have a printer, or if your main source of internet connectivity is your phone, so many of the remote learning and other supports required a browser, and other ones were optimized for an app or a tablet or a phone. And so there's a lot that can go wrong with the technology side of distributing information and getting things out there to the families that we were supporting. And we found that just really simple, the quickest and easiest things, like if you did it in, like, 2 clicks was almost too many. If they get the email, they can click it and the support is right there. The thing that they're looking for is right there. But was really key for us as we were navigating how to communicate, how to send these resources out to families.
Thank you. That's valuable. And we as physicians had to deal with the digital divide in providing healthcare services to many of our families who were impacted during COVID, basically using their phones to connect with the doctor, to access care. So yes, simplifying, providing service, these kinds of supports are essential. I'm going to change this question, actually. The third question was asked in the earlier panel. We've talked about the effects of the COVID pandemic and the disproportionate in the health and the disparities and communities of color, of Black, Brown communities, of Asian communities, Native American, immigrant families. How has this field, recognizing this, how has the field moved forward a little bit to address some of these unique, mental health care needs in these communities in a way that celebrates individual identities? And Dr. Dougé, I'll start with you.
Yeah, again, another wonderful and important question. I think one thing that's really been prescient is the fact that there's an acknowledgement, right? The data informs what's focused on and what's done, right? So if it's not measured, you don't know if it's done or how well it's done, right? So those metrics are important. But I think beyond the data is really understanding the context that families live in, and racism, structural racism being one of those contexts that really impacts policies and decisions that ultimately play a role in families and children's life, and to afford them optimal well-being, right? That promise of happiness, joy, those prospects. So I think having that understanding that one, there needs to be something that's done, but going beyond just the data, right? And going beyond the acknowledgement, what changes, what policy changes are we really making, right? Who are we partnering with as pediatricians or child care providers to assure that families are addressed where they are? and not solely focusing on the negatives of the data, but also really playing up, taking a strength-based approach to families and how culture plays a role in that well-being and how the family's doing, and working with families to find out what strengths they have, what needs they have. But I think other than that, and I think there's more trainings available to providers, right, to provide this context and to provide opportunities for training, individual training for providers, to know how to ask the right questions, right? Because I think for too long, our biases and assumptions, right, the way we're taught, I can speak about the medical field, right? Being a person of color, being a Black woman, or even just being a physician, right? None of those things afforded me the opportunity to have the training on how to have these conversations, right? But I think there is an assumption that because you are a person of color, or you happen to be, minoritized, in a minoritized group, that you have some strengths and skills that you aren't taught, right? But there's an assumption about that. So I think there's now an understanding that everyone needs the training. And we also need to really work on the pipeline so that we know that we can increase the representation of providers for our families. And if we don't have that number, again, those trainings to afford the opportunity for all providers. And that's a slow process, right? So that means changing policies across the board in terms of hiring, funding. So all those still need to be taken into account, and then really working on a community level to really look at all those aspects. Because, I look at the health aspect, but when a family comes to me, if I write them a prescription and they don't have health insurance, or they're from a mixed family, some family members have access to insurance or have insurance and others don't, that makes a difference, right? Do they have access to clean water? Do they have access to food, right? So all those are the contexts that I have to take into account when I work with a patient, and then really working within the community to try to find supports for the families that I serve. So hopefully that answered the question.
Any unique supports that you recommend, resources that you would, for pediatricians, healthcare providers, for these unique populations that you serve?
Yeah, but that's the thing, right? So I'd like to go back a little bit. I think it's true, right? Our identities do provide some, this is how I look at it, right? Does inform who we are, right? But when I see a family, whether they're Black, Asian, white, Hispanic, Asian American, whatever group, however they identify, first I meet them, they let me know who they are, right? So having this cultural humility to try to find out from my families, one, how, again, that was in the prior panel, right? How are the children doing? How are you doing? And the resources even start from the beginning, when patients register and enter the door, right? Are they allowed to say who they are? Pronouns, identity, socioeconomic, racial identity, and that's all in totality. But when I meet someone, just because they're Black or Hispanic, that's important that I take that into consideration, but I'm taking that person as a human being, understanding that those other aspects of who they are inform, or potentially could inform, the choices in the conversation, and being willing to listen to that. So I think resources are definitely, trainings are important. For many pediatricians, the American Academy of Pediatrics has a free training with continuing medical education credits about how to talk to families about racism, or having those conversations. I know in Maryland, where I practice and live, there are mental health trainings on cultural humility, and how some interview skills with families, motivational interviewing, and also I think just doing our own trainings in terms of checking in with our biases and really learning about what resources in the community. because again, it's not a racial issue or a cultural issue. Sometimes it's socioeconomic. Unfortunately, race and culture impact that because many communities of color are disproportionately affected. And when we think about that, it's not race or culture that's influencing where they are. It's the structures and the systems that have allowed this disproportionality, and understanding that as well. But again, whatever, screening for social determinants of health to find out if families need access to housing, insurance, those are also important resources to help families.
Thank you for your answer. This was very, very comprehensive. Thank you. I would like to ask Dr. Caballero, as someone who works and does research on the immigrant population, can you address this question in regard to the many immigrant children and families that you work with?
Yeah, I think that I agree with Dr. Dougé about the amount of attention brought to the great disparities that sort of are, those of us who kind of are in the trenches with immigrant communities sort of already have been struggling with, but then seeing the disproportionate amount of infections with COVID, people taking a deeper dive and looking at how many people are, hospitalized, have worse infections or more severe infections, and looking at how that affects different communities. And I think that that was useful and helpful because it brought attention to the issue. I think a couple of examples of things that I've seen, and I also practice in Maryland, is that, almost immediately we became a food bank site, and we've always had, we've always served families with low income, but all of a sudden that the basic necessities were, everyone was on board with, let's make this happen, things that, maybe we had been thinking about, or, or hemming and hawing about, all of a sudden it was all hands on deck. And that's been extremely, obviously really important to the health of children and families broadly. And I think another thing too, is that, talking about delivering care in different ways, like telemedicine, I think, we kind of underestimated our families' abilities to do telemedicine. We have our medical record system, the patient portals available in Spanish. And, there are certainly problems on the other end of that. If you're receiving a message and you don't understand the language, I've certainly have some struggles with that, with people sending messages back to the provider in Spanish, and then it's taking a lot longer because they have to wait to find somebody who reads Spanish to interpret it, which I think is a big problem. But the ability to connect electronically, walking people through that was time consuming, but, people just need directions and they need to be walked through stuff. Like Scotty was saying, we're all kind of on the same page. And I think that, there was this, oh gosh, well, Spanish speaking film is just too much. It's like, well, we didn't give anybody a chance, and people stepped up and they said, sure, tell me what I need to do and I'll do it, And so I think that was also humbling, on a systems level, to say, yes, we can do this. We just have to put the effort in, and then people will come on board and meet us where we are. I think we've always, those of us who work with, people who have emerging language, English language proficiency, is the access to translators, especially for families with children, they're not the patient. Sometimes we have patients who are young and don't speak yet, and families who speak Spanish, or the adult caregiver who speaks Spanish. And then for everyone, it became a little more obvious and tangible because there were masks, there were, isolation, so you couldn't bring an in-person person into the room with you in an inpatient setting, perhaps in a critical setting where you had to explain a difficult situation to a family member, and people physically saw those barriers. Like, it's too hard to use a phone and use a mask and talk to somebody. It's too hard to use the tablet. So then all of a sudden, a lot more people were on board with solutions. And one example is in our hospital, we had some volunteer clinicians who, when we really had to have a very serious conversation, they were kind of on call, and they came in person and, was with as a team member to talk to that person in the primary language. I think too, what was another thing I was thinking? Dr. Dougé, when I was thinking about too, as far as, tools for families. Not there now, we're seeing, you know, I see families who typically come from Mexico, Central America, sometimes South America, and you know, I've gotten to know the families and you know, the different sorts of reasons that people migrate, including, you know, personal trauma, you know, environmental disasters and lack of job, you know, lack of jobs, sort of better opportunity for their kids, and you know, with that comes different kinds of, you know, trauma as well. And I think about, you know, as people are generally migrating, and we may see more, you know, Afghan refugees in our clinic, or people who really come from different types of cultures and different types of cultural norms. It's really, you know, it's really hard to say, oh, I really know all that. You know, I can learn all that. Oh, I know that, you know, with a family who's Muslim, they prefer, you know, it's more, you know, appropriate for me to sit here or do this or do that. It is, you know, we're, as being open-minded is important, but I think also thinking about the idea of trauma-informed training, because while cultural humility is also really important, maybe on top of that, and in addition, is trauma-informed. So, you know, people who have, every time they come to healthcare, they have not felt safe, or they haven't felt heard, whether that's because, you know, they've had felt discriminated against, you know, in that setting, whether they feel like it's so similar to, you know, like people in prison. This feels like a prison to me. You know, this feels like, I don't feel like I'm heard. I feel like I don't have control. And those can come from different places, but our ability to accept that stress, or accept that fear that's coming from families, is really understanding that it's coming from a trauma, you know, in a trauma-informed way, like really stepping back and really, you know, meeting people where they are. And I think that can be helpful as, you know, kids come in with parents who may be anxious, depressed, and that can come out in different ways, or they feel discriminated against, they don't feel they're, you know, this is a trusting environment. Our ability to step back and say, you know, this isn't really about this interaction, it's about something bigger going on, and I'm going to sort of accept this and figure out how to help, because that's what I'm here for. You know, so that is also sort of an important layer of what we can do in the clinical setting to help support, you know, families who may be dealing with different types of trauma.
Thank you for your response. And Scotty, as someone in the content creation field, how does child media influence mental well-being, and what progress have we seen in the media and publishing industry?
Yeah, I think media and storytelling has a huge amount of cultural power in a really broad sense. It's a big, clumsy tool, but it's an important one. I think in the last few years, we've started to see some really interesting stuff happen. One is about sort of moving away from the notion that, well, we just don't see color, or what used to be called colorblind casting, which meant you would cast a person of color in a role that maybe wasn't traditionally played by a person of color. And what we've moved towards instead is more of a holistic understanding that one's race, one's identity, one's background informs a lot of different parts in your life. Two examples that I was thinking of, one is Turning Red, the Pixar movie that just came out, where you have a Chinese-Canadian character, and then The Falcon and the Winter Soldier. We have a Black Captain America, which is awesome, but it's not just that the character happens to be Black and is Captain America. The story that was told there really delved into a lot of different parts of his identity and how that integrated with his role as a superhero. So I think we're starting to see some really great examples of not just identity being sort of holistically integrated into different stories. For us in the Imagined Neighborhood, one of the things that's important to us is quantity. That you know, if we don't just have, say, one Mexican character and she has to respond, she has to sort of say everything for every Mexican character. She can be her character first, and part of her identity is that she's Mexican. Having multiple stories with different characters with different backgrounds allows us to have that kind of it allows us to stay away from like a very special episode kind of thing. We're like, let's talk about why your Christmas is different than my Hanukkah kind of thing. And it just allows the stories to take place as they go. And I think in the larger media context, you're seeing that more and more. that kind of representation can be really important for kids. So they can't see it if they can't be it. Or sorry, they can't be it if they can't see it. If they want to see who they are on screen or in the stories that they're told, then they'll be able to imagine themselves in that role. I remember talking to some parents about Doc McStuffins and how powerful that was. That it just was, it's a very simple show. It's a lovely little show about a doctor who takes care of stuffed animals, but for kids being able to see that character in that role was so important. It just allowed them to see themselves potentially in that role as well. I love that notion, the notion of cultural humility. That was a lovely phrase, because it turns it from something that is a box that you check. Like you say, sort of cultural competency, and it makes it sound like that's a box you check. I've got my woke certificate here, and therefore I am woke, no longer racist. Whereas humility sounds more like a practice, and a thing that's done regularly, and that's something that we work on. We know, and I think when it comes to the larger media ecosystem, you're starting to see those steps being taken in that direction. The conversations are happening. Characters are allowed to have their identities as part of the larger story that's being told. Rather than sort of being a cipher or an example of something that that is representative. We worked with Dr. Aisha White of the University of Pittsburgh Pride program, and a lot of the work that we've been doing is around that notion of racial identity development, that kids are able to see themselves in a variety of contexts, and they're able to see people who look like them, people who represent their neighborhood, people who look like their aunties and nanas and uncles. And so being able to have that as part of their media diet allows them to sort of see the broader stroke of the broader swath of humanity out there. Yeah. And the other notion about quantity that I always like to mention is, like, as parents are looking to diversify their book collections or diversify their media collections, it's that quantity notion. It's having multiple stories. If you want to learn more about what it's like to grow up as a Hispanic person in a given community, like, have a lot of books about that. Have different kinds of stories, because then you're not just using one character as a representation for entire identity.
Yeah,
Did I answer your question?
Yes, you did. Thank you so much. Yes, it's about representation, offering diverse characters, having children see themselves, and in the office setting, it's making those connections with families and the children, and being supportive, and developing that trust in the very longitudinal relationship that pediatricians have in the office setting, and trying to identify and help navigate some of these difficult mental health issues, and trying to find resources and reaching out into the community. So it's kind of all a balance, and building on what we've talked about in the earlier panel discussions as well. Do we have time for the two more questions, or should we go to the Q&A? Maybe I can just ask this one. How can we, as medical professionals, education advocates, parents, allies, support children's mental health? Dr. Caballero, we'll start with you.
I think, in a clinical setting, it's normalizing those discussions. How are you doing? How are you feeling? Using, it's okay to say anxious. It's okay to say sad and depressed. Because adults are familiar with those terms, and like, you want to just make that part of your vocabulary and say part of what you just talk about in every visit, if possible. Because things change every time you see a family. So I think some of it is normalizing it, celebrating wellness too, and that sort of, again, building from a strengths-based approach. Celebrate your child and your family's strengths, and modeling that, again, joy and wonder of things, because I think that in our world of a lot of stimulation, auditory stimulation, visual stimulation, finding that quiet space to just enjoy the simple things. People talk a lot about how nature is really important for well-being and wellness and mental health. Modeling that, going for a walk with your child, no phones, just really that quiet, is really important for healing, for just, thinking, and for your child to start speaking, right? Sometimes just a quiet walk or a quiet moment, or sitting on the floor face to face with your child and playing. And, you know, that's the space where they ask those really fascinating questions, or, you know, tell you about what happened at daycare or school, that can really start some of the, you know, what's the thing that's been on their mind, you know, whether it's a doubt they have, they need some reassurance, something sad or scary happened, you know, something really wonderful happened. So I think it's giving people tools that they can, that is really tangible to everybody. Because I think what shuts people down is saying, oh, well, you go here and you go online, you know, like Scotty was saying, well, you just go online and you print these things, or go to the store and just buy organic blueberries. And, you know, it's like, people want to do that, but you want to give people things that they empower them, you know, that they say, oh yeah, of course I can do that. I can sit. When I talk about books for families who don't speak English, I say, just name things on the page. Some of my families can't read very well in their own language. So we have books in Spanish or bilingual books. And we often say, it's so great to just sit with them, name things on the page, talk about what you see. You don't have to read it. And I just say that, you know, I say, you don't have to read what's on the page, just talk about it, you know, just name the different things. So I think some of those things help you get closer and, you know, to that sort of therapeutic alliance and meeting people where they are.
Thank you. That was great. Scotty, do you have any contributions?
I hope so.
Yeah, you do.
Just to follow what Dr. Caballero said, like one of the things that's really been effective for me as a parent, and also in talking to other professionals, is waste some time with your kids. As a parent, you know, I'm a single dad, and I get really, you know, you can get really wrapped up in getting food on the table and getting to school, gotta get to work, make the lunch. There's all these things, and the things that the kids are gonna remember the most, they're gonna respond to, is the time you spent with them. As a physician, it may be, you know, you may be backed up. You may have 2 patients that have been waiting for 20 minutes, and you gotta get, you know, this kid this shot, and you gotta check here, but like, the time that you waste, that extra 30 seconds of checking in and saying, what is your stuffed animal's name, and what is her profession, or the little extra time that you can take goes a long way in making those connections with kids. And those are the things that they can remember. That yeah, it might be scary to go and get a shot, but you know, the doctor did he put the candy wrapper and made a mustache, and that was hilarious. And that can be super meaningful. And I was thinking, again, just to underscore what Dr. Caballero said, that talking to kids about your own feelings, modeling those positive behaviors. If we want to have kids that are able to talk about their emotional state, their well-being, you as a parent being able to do that, or you as a professional being able to do that in an appropriate fashion, a kid-appropriate fashion, goes a long way to showing that, you know, kids are gonna they're gonna be what they see. And so if they see the adults in their life, they see the grown-ups saying, you know, this shot is kind of scary, isn't it? I got mine and it was a little scary, but man, do I feel better now that I got it. It allows them to say it's okay to have those feelings, and it's okay to talk about them, because look at all these grown-ups around me that are doing it. Those are my 2 big thoughts: waste some time and model the behavior. Show the kids what you want them to be doing.
Thank you. That's a very valuable contribution to this discussion. Thank you. And Dr. Dougé, I'd like to hear some of your responses to this question.
As always, I love Dr. Caballero's and Scotty's recommendations. I think though, like on a practice level, some recommendations, I think for us to be allies and better help advocate for support children's mental health. I might say one, you know, going back to the previous question about, you know, how are we doing better, right? Given the disparities data that we have about COVID and mental health. I think, you know, one thing that I think would be helpful is I've had patients ask me, our patients' parents, right? Maybe some patients too, they're teenagers, ask me about racially concordant or ethnically concordant mental health providers, right? So a Black family might want a provider who's African-American, or a client may want a Spanish speaking, or whatever their preferred language is, their first language. So really finding the resources in the community that are helpful, like, you know, kind of like this checkbox for families, right? how to help them navigate the system, right? Because I think a lot of times it's, we're rushed, right? We say, oh, contact your insurance company. And that sort of distances the relationship between you and the family. So if we have resources already to help families with that, like, that takes some work though, right? What are the where are the sources for families if they want to find a Black therapist or Hispanic or Asian American therapist, right? Or therapists that speak multiple languages. And many of our communities already have those lists developed, but we may need to develop those lists in our own practices. So I think that's important. I think if we can, if practices have the financial resources or systems have the financial resources, really invest in training and make that a priority for providers to learn about mental health. Because a lot of us, right, because there's a shortage of practitioners, and during COVID, there was a long wait list. We felt frustrated, right? We know this child needs this therapy or needs medication, and we're kind of like, oh, that's not my forte, that's not my lane, right? I don't feel comfortable prescribing antidepressants or anti-anxiety medications if that's needed, right? So we need to learn how to screen, right, for anxiety, depression. We need to know what resources are available once children screen positive, and maybe what are some interim resources we can provide to families who are waiting, or it might be harder to place them because of insurance status or just because of lack of access in our communities. So really investing in the training, the mental health training for providers that are caring for families. And again, trying to find out where in your community, connecting with behavioral health, like in the state of Maryland, each local health department, my understanding is that they are the local coordinating group for mental health and behavioral health in their county, right? So they have resources for providers, and many of them have already come up with lists with which providers take which insurance, if it's public or private, maybe on a sliding fee scale, language, and may even have directors that even provide even more granular details for families. So I think those are important. Like, how do we help the families once we've screened for it, and how do we even screen for it as part of and normalizing the conversations? So those are my additions.
Thank you. This is also kind of leads into the next question, but also in terms of, I work in a teaching hospital, and this is a big focus is educating the next generation of pediatricians on mental health care screening and being comfortable in making the assessments and providing treatment. And we know there is a shortage of therapists throughout the country, and there's lack of access and long wait times. So what are some things we can do in the office? What are resources that we can offer our families, the children, to talk about emotional intelligence and regulation and things that we can use in our own toolkit when we see these families? And I'll start with Scotty, because I like a lot of this play and imagination that you have to offer, the creativity, the positivity, and the creativity that's involved with some of your work.
Thank you so much. Yeah. Well, the Imagine Neighborhood is available freely on every podcast platform. And for any physicians out there, we do have stickers that we can send you free of charge that say, "How are you kind today?" That's our catchphrase on the show. We also have a mindfulness series. It's a sort of short audio series called Mind Yeti. That's designed for kids. Those are freely available. I can throw some links in the chat. There's also another show called Stoop Kid Stories that is not explicitly about emotional wellness, but the creators do an amazing job of interweaving some of that into the stories. And so I recommend that very highly. I think one of the big things that adults can do is engaging with kids around the stories that they're already watching. And having some of those emotional well-being and some of those conversations about the characters in the shows and the movies and things. How do you think Uncle Stan felt when his brother came back? Or why does Ang trust Zuko? And being able to explore even in the picture books, like showing like what do you think they're feeling right there? How would you feel if that happened to you? Having some of those questions ready. To explore how kids are experiencing the media that they're consuming and the emotions that they're seeing in it, gives you this great insight into how they see the world and how they see the way that different people interact. So yeah, I guess my two recommendations are things that I make and work on, and things that and have conversations about things that
Dr. Caballero, I'm going to go to you next, and then last to Dr. Dougé.
I'll be brief because I think I alluded to these in sort of the answer to my last question about simple things that parents can do. Also being aware that a lot of my families too, you know, work overnight. They don't do sometimes the bedtime routine, or it's, you know, another caregiver, or they feel really stretched. So the idea of sitting and discussing, you know, books at nighttime may not be part of something they feel like they can fit. So I oftentimes say it's the quality over the quantity. So that's why I say really tangible moments where they really know that you are 100% focused on them. It's that reconnection, reassurance, especially for parent. I have older siblings with young kids, and the parents say the older kid just needs to, you know, figure it out. I have this baby's really a lot of work. And of course I love my kid, you know, they don't feel like they're doing anything different, but that child just needs that reconnection. So I just say it doesn't have to be a lot of time, but it really just needs to be consistent and high quality. No phone, no nothing, just you and that person, to really make it doable, you know, doable, and not something that is like, oh gosh, I'm so stressed, I'm not even reading to my kid every night. I go to work, like I must be a bad parent, you know. So really trying to make things flexible. I say things like, some families do this, some families do that, as a way of not telling them what to do, but also just giving it as sort of an example. And I say, whatever the routine of and I say things like, sometimes people, you know, the routine of your family, you know, these are some suggestions that work for other family, but think about what might work in the rhythm of your own family life, you know, to try to also keep it open-minded, but give some simple suggestions.
Thank you. Dr. Dougé?
Oh, I think both Scotty and Dr. Caballero shared, I mean, a lot of great resources, but I think ultimately, you know, providers just making sure they have resources that maybe have been, maybe I would say, maybe we should ask our patients in some ways to be resources for us to inform how we care for them as well. So, you know, if there's a parent group, like a Mocha Moms or some other group, a church, stakeholders, right? But also compensate them for their time, right? So, you know, so you value their input, but there should also be an honoring aside from, you know, whatever is necessary, gift cards or something, right? I think that's important. But, you know, vetting with them, you know, what resources work for them, right? So there's that idea of that community participation and what we provide to families. And that's even the one-on-one, I think, like Dr. Caballero was saying, right? Listening to our patients as opposed to being talking down to them or talking to them, really that reciprocal relationship. And I think those are the important resources we can provide. I think is our time, listening and engaging and learning.
And that's a wonderful summary of everything that encompasses this particular panel discussion. Engagement, time, listening, making those, collaborating with the families, and asking and meeting them where they are, and making things of high quality and tangible moments. I like that. Thank you.
Thank you, Dr. Kokotos. Thank you, panelists.